Okay, well, hello everyone, and thank you so much for joining our CFHI Practicum Showcase. Today we're going to talk about CFHI and about our practicums. A little bit of background about CFHI. CFHI is a nonprofit organization that offers ethical, fair trade, global health education opportunities to students, as well as academic institutions including internships, electives, rotations, practicums, which is what we're going to be focusing on today, programs, and more. So when we come to CFHI and what it is that we do, we bring a very distinct approach to global health education that emphasizes health systems and existing resources, focuses on assets and positive efforts within communities, upholds local practitioners as experts in their own environments, and practicing fair trade learning and partnerships. When we talk specifically about practicums, practicums are designed to be a structured, supervised, and evaluated professional experience for master's levels and professional level trainees to apply and integrate their relevant knowledge, skills, and values into a real-world setting. It is a meaningful learning experience, which will allow students to be able to address global health competencies, and it is constructed based on global health education practices, focusing on local strengths and prioritizing sustainability and contemporary international development principles. Most students receive academic credit, and this helps them in order to complete their degree. And when we talk about project opportunities, how are they created? So all of our practicums are tailor-made for each opportunity, and where they are constructed with three different important actors in mind. Of course, the academic institution and what requirements they may have, student interests, affiliations, and expectations, and most importantly, local realities and needs. And it is in this area that practicum opportunities are found and are created for each student. What can these practicum opportunities be? Well, there are many topics within global health. We have child and maternal health, we have epidemiology, we have health education and promotion, sexual and reproductive health, nutrition, amongst many others. But when we talk about the programs themselves, or what are the project areas, we can focus them on these, although these are not exhaustive. They are continuing quality improvement projects, which are a crucial skill for the 21st century health professional and global health experts. And it's an indispensable process which involves collecting data on existing conditions and formulating plans for interventions and obtaining input from diverse stakeholders. It's important to note that these projects are designed for the enhancement of the central organization, and they don't necessarily need an IRB process. Secondly, we have the capacity building and co-education, where it's the enhancement of skills and knowledge amongst healthcare workers, NGO leaders, and community members. And during the CFHI practicum, trainees are given the opportunity to actively engage in capacity building activities. It's also important to talk a little bit about reciprocal innovation analysis, which is a pivotal asset when we talk about local global health. And it involves taking strategies that are developed in resource-constrained settings and implementing them for more affluent environments. So this is also a possibility. We can also talk about program evaluation, which is the assessment of programs and intervention effectiveness, as well as other aspects, including the management and analysis of community-based organizations. When we talk about a critical reflection portfolio, we can see that it serves as a platform for trainees to compile a series of essays capturing their critical reflections about global health. And these topics can include social justice, health disparities, cultural norms, socioeconomic policies, and ethics, as well as more. Case studies compendiums allow students to be able to integrate evidence-based medicine by consulting relevant literature, WHO treatment protocols, and region-specific burden of disease epidemiological data for their understanding of the real-time encounters. To go finishing off, when we talk about a literature review, it's very important to be able to understand the context with which we are working and understand current practices and being able to include it into a robust literature review. And of course, when we talk about a no-do gap, it's crucial in global health, highlighting the disparity of what is known and what is actually done, and being able to through different comprehensive reviews, be able to create protocols for those gaps. So that's a little bit of what these project and practicum areas can be, and they lead to different deliverables. So what might these deliverables be? And here we have an example that was actually carried out by one of our students for a program in Ghana. But we have this one on cervical cancer, but it could be a grant proposal. We could be talking about policy briefs, about creating culturally competent educational material, a robust literature review, an informative video, or an evaluation plan, amongst others. And again, what these are determined with different things in mind: academic requirements, student affiliations and interests, and importantly, what is going on the ground and current needs. Now, I would like to be able to talk with one of the people that or someone that has already carried out the experience, and that is Helena. Helena was a virtual global health practicum student for India in 2022, and her practicum focused on positive and negative behaviors that affect child health and development. So Helena, thank you so much for being here today. Could you tell us a little bit about your experience with the virtual practicum? How was it created? Were your interests, and expectations like put into your outline and into your practicum? And were you able to develop these skills?
Thank you so much, Juliana, for having me. And good morning to you, or good afternoon, good evening, wherever you are. Yeah, so it was a journey. Let me give you just how I got into CFHI. So I had reached a point in my studies where I needed to do my internship so I could graduate. And it was a challenge. I mean, Baylor would give you recommendations. I had reached out to a lot of organizations here in the US and elsewhere, and I wasn't getting any response or feedback from any of them. Those who were reaching back out to me were just letting me know that it was COVID time and they were not taking in students. It was terrible. I was frightened. I was like, why would I get to this point, and how would I be able to move on, because I needed to finish school. So I had attended one of the oral presentations of the other students on campus that's done virtually. And during the presentation, she was mentioning CFHI, CFHI. I was like, what is CFHI? So I just quickly Googled it, CFHI, and then it popped up. I was like, oh, okay. So continuing to listen to her, I think she had gone in person to the country where she had done her practical. But this was COVID time, and all these things, social distancing and flights were canceled and all that. So I quickly went to the site. I think I filled out a form, and then in less than 48 hours, somebody reached out to me. I was surprised. I was like, wow, where has this been all this while? So just before I forget, if your school does these oral presentations and other things, I would encourage any student here to take interest in it, because has it not been for somebody's own, I don't think I would have been able to find CFHI. So I reached out to them, and then here we got started. So I was asked whether which language I was interested in, giving options of countries or places that I could do it. And I'm originally from Ghana, so I was like, no, I don't want to go to Ghana because I already know the health system. I wanted somewhere else so that I could get other experience. So then India pops up. I was like, yeah, I'll be interested because I've been to India before. So then Mrs. Hema Pandey comes on, and then here we are. So I came in with what I wanted to do initially, that was on child nutrition. But then when I got the agency to work with, the agency director made me aware what their need was, which is in line with the topic that we have here. So he wanted me to develop some materials for their pregnant women and new mothers on things that could help them during that phases. So provide emotional support for the pregnant women, because he had identified that most of the complaints the pregnant women were bringing were not medical or were not like pathological. They would run all tests and other things, and these women will be fine. So could it be something else was bothering them that they were not able to present very well? So we had a discussion. We were having meetings because of the time difference. It will usually be around 11 p.m. my time and all that. And then we will discuss. So myself, Mrs. Pandey, and the agency director, bless his soul, who has gone to be with the Lord, Dr. Vijay Kumar, they will take me through what they thought, and then I'll have to come back and sit down based on what I have studied, and then come up with ideas on how we were able to handle these women. So we're looking at, was it something positive that was affecting them at home, negative that affected the women, and effects rippled over to their families, their children, their husbands, everything. So I took into consideration the totality of the family and looked at some various social determinants of health, social and community context, education, economic stability. I looked at all that and ways in which it could affect child health and it could affect development. So I had to sit down and apply whatever had been taught. And then we came up with some beautiful educational materials, which the community agency director was really impressed with. And I actually applied the socio-ecological model to my work. And that is how I came up with whatever I came up with to help. So we did that. And yeah, so we'll meet weekly. He will give me assignments. He will tell me what next to do. I'll go back, sit down, read, research, come up with whatever the deliverables are. And then we meet and then we share. He will bring his suggestions. He will bring his corrections. We will take it, go back and apply it. We did that for, I think, if I'm not mistaken, about 6 weeks. And then the final work was produced. So it was very helpful. Mrs. Pandey was very, very instrumental in making sure that all the meetings were held. He will send the links. He will make sure that the agency director and his assistants are on. And I really got the help that I needed. I didn't feel lost. I mean, I could reach out to any of them any day and I would get response through WhatsApp, through email. They were there to support. And the feedback that I got from them really made my internship work go smoothly, I must say, because after I had done everything, I presented the work to them. They saw it. He was very impressed. He was like, okay, so now what needed to be done was to try and translate some of the materials into the local languages of the women within the catchment area so that they could understand those who did not speak English. So that was the next line of action. And I must say it made my the whole process very smooth because the corrections and everything had been made already. So when I presented the final work to my supervisor at school, I mean, I didn't have to go back and forth with her. Truthfully, she had to look at it twice, and she was like, Helena, you are done. You are ready for oral presentation. And I was so excited because I was like, when Dr. Kuma was giving some of the suggestions, I thought sometimes I felt like this is too much. But I think in the end, it really helped because after applying them, it didn't take long for me, for my internship work or my project work to be accepted, and we moved to the next stage. So we looked at positive behaviors. Let me come into a little bit of that. I looked
Helena,
at
sorry, thank you so much for that. If you can tell us briefly about those positive behaviors, and
yes,
then I
that's
would
what I'm
also
going
like
to
to
do.
know,
Mhm.
awesome. And then if you can tell us a little bit about how you've been able to apply what you learned at CFHI in your current job.
All right. So social and community context, I looked at the area of what's how the culture, I look at the culture of India. How does it affect women? Because in the family, I think the woman is the driver of the home. She makes most of the decisions. The man, yes, provides, but to keep the home together depends solely, or majority of it depends on the woman. So I looked at how the culture is affecting the woman. And from research, in Indian culture, the women don't really have a say in most of the things. Sometimes their in-laws have more say than them, the husbands have more say than them. And all these things causes emotional stress for the woman. So when the woman is stressed in pregnancy, when the children are small, in taking decisions, the woman is not well rested, the woman is not able to get the support that she needs to be able to run the home. It ripples over in the way she attends to the child. I also looked at the educational status of the woman. If the woman is well educated, has been exposed to a lot of things, yes, she makes the right choices in taking decisions for the home and for the children. If the woman's educational level is low, it affects the quality of her decisions. So these are some of the behaviors that affect child health and child development. And it all starts from the home before it comes outside. I also look at economic stability. Is the woman employed? Does she solely depend on the husband? Does she solely depend on family? Is she somebody who goes out there, who works and gains something for herself? When she needs help, when she needs something for the child, she's able to make that decision on her own in consultation with the husband. If the child is sick and she has to send the child to the hospital, she is not now waiting for the husband to come home before she sends the child to the hospital. So these are some of the factors that I looked at. And right now where I am working, I'm managing a community health center where there is a clinic and it's a family practice center. So we have all these people coming in. So there are times when I organize health education for the mothers, for the pregnant women, and for those with little children. We meet, we talk about what their fears are, what their challenges are, and then we brainstorm more like focus groups. We brainstorm, and then they come up with ideas, and they help each other. So somebody is able to pick another person's idea and say, hey, I think when I do this at home, it's going to help when I implement this. So those are some of the things that we do here. And I believe that if I hadn't gotten this avenue to do this internship, and what I was coming in was on child nutrition, but I believe that whatever the agency gave me to do, and I had to go write a new proposal and everything, has paid off, because right now I'm able to help the community in which I work as well.
Thank you very much for that, Helena. Thank you so much for telling us about your experience, about what you learned, as well as how you're able to apply this day to day. Thank you so much. And now we're going to move over to Thea Santiago. Thea Santiago is actually going to represent an on-site global health practicum that she carried out in the Philippines, if I'm not mistaken, almost a year ago in May. So Thea, can you tell us a little bit about what it was your practicum. You were working with rural health unit programs and you analyzed different programs. Can you tell us a little bit about that, as well as how this has carried out to other areas of your career?
Hi everybody, again my name is Thea Santiago. I am a second year MPH student at the University of Illinois Chicago. So just to start off, I found CFHI from an alumna of my university who did her applied practice experience, which is an academic credit that we get from participating in a global health program. So in terms of the process, it was very smooth and very quick, just like what Helena said. CFHI is super quick with their responses. I started reaching out February 27, was able to apply and already communicate between my CFHI coordinators and my academic advisors about my my agenda, or what basically I wanted to get out of the program, as well as talk about some deliverables by March 2nd. So again, very quick turnaround. In terms of when I finally met my local preceptor and coordinators in person, the entire program just felt like a community of passionate leaders united to have that one goal, which is serving their people and their community. And I was just really impressed by the collaborative environment and teamwork that I observed between the coordinators, because they really wanted me to get the most comprehensive experience during my stay, and it really felt like that. I learned about both Manila and Alcantara Romblon's hospital system, and was able to do some hands-on learning that allowed me to apply existing skills and knowledge that I already gained from my coursework effectively. My preceptor is Dr. Jobin when I was there, and guided me by creating learning objectives of my day-to-day schedule while working at the rural health unit. And I was a part of a bunch of health promotion events to reduce health disparities and empower residents, including the cervical health education month that they had, which was a whole day event, especially for women in Alcantara. And I had the opportunity to learn and review the Philippine Integrated Disease Surveillance and Response System, and engage in focus group discussions as well as key informant interviews with the rural health unit staff as well as the provisional health staff. And I gained valuable insights into the practical complexities of disease surveillance, and I identified opportunities for improvement during those conversations that we had. And that was my first deliverable that I submitted to my university. Another deliverable was from when I actively participated in the Chikiting Ligtas vaccination campaign, which is for 9 months and above children in Alcantara, Romblon, where I organized public health initiatives in, again, resource-constrained settings, and I was able to observe what capacity building looks like firsthand. And I wrote up a post-implementation review on the data from the entire Mima Ropa Islands, again, which is what Romblon is a part of. And my third deliverable was creating a report on the adverse effect following immunization for one of the children we vaccinated for measles. And so I was able to learn how reporting that to the Department of Health was like. So overall, my practicum experience has profoundly shaped my understanding of global health and equipped me with the skills and knowledge needed to make meaningful contributions to public health in the future. I would definitely say my time with CFHI was enriching, that enabled me to make tangible contributions and expand my understanding of intricate issues in global health. As well, I did a lot of journaling throughout my whole experience because, again, I learned so much every day. And that was the only way I could return all the information I learned. And I really used what I journaled to reflect on what I'm doing now as a second year MPH student. And also my job currently, I'm an outbreak response member for UIC. We partner up with two different hospitals, Rush University Hospital System, as well as Chicago Department of Public Health. And actually, because we have a lot of migrants coming into Chicago right now, there is a measles outbreak here. I don't know if you have heard about it on the news. And our team has been vaccinating all the migrants here to make sure that we can mitigate the outbreak. And just funny that, that is what I learned last summer. And I am taking everything that I learned there to the work that I do now.
Thank you for that, Thea. Thank you so much for telling us about your experience in the Philippines. It's a very unique experience because you get to see it not only in Manila, but also in a rural setting, which, of course, as you say, really prepares you for things that are back home. And it's great to know that you've been able to apply that and take that back. Now, to have another perspective, we're going to be hearing from Dr. Joffrey Anguyo. Dr. Joffrey Anguyo is our medical director for CFHI in Cavite, and he's also a practicum preceptor for both virtual and place-based practicum. So, Dr. Anguyo, thank you so much for being here today. We've heard the impact that practicums have had on different students from virtual and place-based. But of course, something that is very, very important to CFHI is understanding how our programs have an impact on the community. And that also implies understanding how they are created. So can you tell us a little bit about practicums around maternal and child health and the impact that they have had currently in your day-to-day?
Hello, good evening, good afternoon, everything, everyone, depending on where you are. Can you hear me?
Yes, sir, we can hear and see you. Thank you so much.
Yeah, thank you. Briefly, I just go direct to the point. I don't need to talk much about myself. Briefly about the practicum, when it is on site, when students come on site, we have orientation, we take them through their areas of interest, and then we analyze if it is maternal health, talking to the midwives, talking to the mothers, and then talking to the community leaders, traditional healers. You get those different perspectives. The myths are maybe what people are not getting right. It is direct. We make them directly interact with these people. And then they come up with a write-up. From those write-up, they look at the gaps. And from those gaps, they, design materials that can be used to address the gaps. So that is when they come on the ground. But then when it is virtual, definitely you can't see. So virtual is a little bit different. And right now we have more students on virtual program than the on-site due to various reasons. Some are working and the rest. So when it is virtual, we first may, of course, their thinking usually is broad. Maternal health, then, you have to skip a narrow because maternal health is broad. Now, there are mothers with HIV, there are mothers in rural areas, there are mothers in urban areas, there are mothers, with first pregnancy, all those areas. So we make them review literature. We share literature with them about maternal health in Uganda so that they get an understanding. And then the lectures through Zoom. And of course, at times network issues And then if you really want to catch up, we use both Zoom and WhatsApp. So then we keep narrowing the theme so that it is not too broad. And then when they review the literature, our lectures feature on the gaps. Eventually, when we identify the gaps together, then they come up with the materials. Like here in Uganda, one of the myths about, around maternal health is a mother, a man cannot buy items for unborn baby, you know. So it's like if the baby dies, they say, but you prepared for the baby before he was born. So a baby is supposed to be born first. So then many times you find the baby is born when actually the mother is not ready, the basic items for the baby are not there. Now, the right materials around that. And then there are a number of myths about the foods that the mothers will not eat. Maybe chicken is bad. Maybe, dry meat is bad, for baby. Those are myths. Then all these materials go to address those myths. So one practicum student did that very well. And we have translated the materials in a local language. What you have seen, this is a clinic outreach where we see, at times over 100 mothers. The clinic runs once a month, and then these mothers are educated, and a number of these health educations have been recorded in a local language. So now you don't, because at times there's only one midwife. So as the mothers are waiting, then you just play the recording in the waiting area. So as they come and keep attending. So now you can see gradually those gaps are being addressed through both the practicum students and then place-based students. So this practicum program is really very, very important. It is helping us a lot. And we have a lot of diversity. This is just in maternal health, but there are also others do HIV, AIDS, nutrition. I mean, all kinds of water and sanitation. So the deliverables are always materials that can help the community, that can help health workers, that can help policy, and everybody, so that eventually when they are working on this area, when there are areas of improvement, then they take up, it becomes part of our input in those different aspects. So I hope those two summaries of both in place-based and virtual has explained it clearly. If it is anything that is not quite clear, please, you can ask a question, and we are happy with the collaboration with the CFHI. And actually, most of the students, as of now, don't know about CFHI. Now I was like, how did you get to know about CFHI? The story is always very long, but now I want the story to be short. So how can we make the story short? How can we make CFHI everywhere known? So Helena, thank you for that. And then it was really touching on what exactly we are doing. And it has, it means whatever CFHI is doing across different parts of the world is coordinated, similar. And I think that is the only way we can bring change in this world. Thank you.
Thank you very much for that, Dr. Nguyo. It's so great to know and to hear from, real perspective from the impact that practicums are having. And it's great to know that we can continue to do that and we can continue to amplify the work that we are doing, of course, always led by local efforts and local leaders, and being able to construct on what is already there, finding those gaps and finding ways to address them. Thank you so much for being here, and please feel free to reach out if you have any questions